Examination of a child can be daunting, especially for doctors who don't have much experience of pediatrics. Hey friends, if you're new here, my name is Dr. Erwin Kwun. In this tutorial, we'll dive into examination in pediatrics. The approach to examination of the child is different compared to that of an adult patient. Obtaining the child's cooperation is key to successfully perform a physical examination. Children are often intimidated or anxious in the presence of strangers. Be friendly with the child. A smile will help to make the doctor appear less threatening. Smiling and including the child in the consultation from the beginning will help build rapport with the child. Stay at the child's level. Avoid towering over the child. Be confident but gentle. Explain in simple language what you want to do and what you want the child to do. As examination is essential and not optional, it is best not to ask permission to the child as the latter may well refuse. It is preferable to start with least distressing and leave most distressing part of the examination until last. Start peripherally and move centrally. For example, you could start with the hands and feet. Physical examination varies according to the age of the child. Examination needs to be adapted to suit the child's age. Consider the position of the child. Should a child be examined on his mother's lap or on an examination couch? Infants are best examined on an examination couch with a parent next to them. A toddler may be initially examined on a parent's lap. Parents are reassuring for the child. They can help the doctor in facilitating the examination if guided to do so. Distraction is a valuable tool. It is often effective to use toy as a distraction while examining a child. Preschool children may be examined while they are playing. School-age children and adolescents may be concerned about privacy. Be sensitive to children's modesty. The area to be examined must be inspected fully. Get the patient to undress and redress in stages. The parent may facilitate by helping to undress the child. A child should normally be examined in the presence of the parent or a chaperone. Make sure you wash your hands before and after the examination. Warm your hands and stethoscope. Careful observation is an essential part of the examination. Look before touching the child. Inspection will provide a lot of information. Inspect the appearance of the child, level of awareness, severity of illness, growth and nutrition, level of hygiene and care. Observe the interaction between the parent and the child to assess the behavior and social responsiveness. Watching the child play will help the doctor assess developmental skills. If the child looks sick, undertake a rapid assessment. Start with airway. Assess for any secretions or stridors. Check for any presence of foreign body. Assess whether the airway is protected. The next step is to assess breathing. Inspect the movement of the chest and assess the respiratory rate. The normal range for respiratory rate varies in children according to their age. Normal respiratory rate for a child under 1 year old is between 35 to 45. Normal respiratory rate for toddlers is between 25 and 35 range. Respiratory rate for a child between 5 to 12 years old is between 20 to 25, and for older children the respiratory rate is expected to be 15 to 20. Assess the use of accessory muscle. Check whether there is presence of subcostal recession or intercostal recession. Assess for any grunting. Assess the level of oxygen using a pulse oximetry. Auscultate the chest. Assess the breathing sound. On auscultation of the lungs, check whether there is any signs of wheeze, crepitation. Is there normal vesicular breathing? The next step is to assess circulation. Inspect the color of the child. Does the child look bluish or gray, or does the child look healthy color? Assess the heart rate. Check the patient's pulse and check the quality of the pulse. The normal heart rate for a child will vary according to the age. For an infant under 1 year old, the normal range is between 110 to 160. For a child between the age of 1 to 5 years old, the normal range is between 95 to 140. For a child of 5 years to 12 years, the normal heart rate is between 80 and 120, and for older children, the heart rate is between 60 to 100. Assess for capillary refill. This will give you an indication of the circulation. So check peripheral capillary refill and central capillary refill. The normal capillary refill is within 2 seconds. Palpate the limbs to assess the temperature of the hands and feet. Are the hands and feet cold or warm? In very sick child, check the blood pressure. Abnormal blood pressure reading is a late sign in children. So blood pressure reading is not measured routinely unless the child is very sick. Normal blood pressure reading varies according to age. For a child under 1 year old, it is 75. For a child between 1 to 5, it is 80 to 90. For a child between 5 to 12 years old, the normal systolic blood pressure reading is 90 to 110. And for older children, the normal systolic blood pressure reading is between 100 to 120. The next step is disability. Assess the pupils. Check whether the pupils are equal and reactive to light. Check the limbs, whether there is a normal tone. Check the movement of the limbs. Check whether the patient is alert, conscious, whether they have to be aroused by voice, pain, or are they unresponsive. The next step is to examine ear, nose, and throat. Examine the ear canals for any signs of redness, infection. Examine the nose. Examine the throat. Check the back of the throat. This can be unpleasant for patients, so it is helpful to assess the throat towards the end. Ask a parent to help you by holding the patient's head still. For a toddler, you may ask a parent to sit the toddler on their lap and hold their head with one arm and hold their hands with another arm. Assess the temperature of the patient. In general practice, we usually use a tympanic thermometer and check the temperature from the ear. Temperature can be measured with axillary thermometer or rectal thermometer. The next step is to examine the abdomen. Palpate the tummy for any signs of tenderness, organomegaly, or abnormal mass. If the child is very unwell or drowsy, check the glucose level. A normal blood glucose level ranges between 3 to 5 in children. If you found this video useful, then you might want to watch another tutorial which focuses on history taking in pediatrics. Click the video to watch it. If you found this video useful and want more videos like this, make sure you subscribe to this channel. Take care everybody. Bye bye.